Homelessness is one of the most frustrating issues because despite so much money being spent and despite more housing being offered than ever before, the problem is still growing. I regularly go out to the different encampments in my district to speak directly with homeless folks to learn about their lives and make sure that they're being offered services, and I try to help get them off the streets. This week, as I've done many times before, I went to the Winnetka underpass with LAHSA outreach workers. My interactions were both depressing and uplifting because the net result is that I helped two people leave the underpass to build a better life. That's 10% of the people who were living in the underpass. One of my encounters was with this 27-year-old kid named Robert. I shouldn't say kid, because although I'm old enough to be his dad, but this guy had a hard luck story. He had struggled with drug addiction for years, had been living in the underpass for quite some time. And we talked for a while. He seemed like he genuinely wanted a way out. He said he had stopped using, but he needed Suboxone to avoid withdrawals, and he also told me about his mother in Colorado. Long story short, he agreed to let me call his mother. And his mother, who hadn't heard from him in weeks, really wanted him to come home. And he wanted to go home. And she assured me that if we could get him home, she would take care of him and find him help. Not wanting to lose the momentum of that moment, I bought him a bus ticket and I helped him get to the Greyhound station so he could be reunited with his family. I literally could see the life returning to his eyes as we went through this process. Now, LAHSA has a program that helps reunite homeless individuals with families across the country, but it sometimes takes a month to get that to happen. And this is just one example of how our status quo isn't working right. It shouldn't take a month to connect people with family who are willing to take them in. Yeah, we need to make sure the opportunities are real, but timing is critical because sometimes it only works when you can seize the moment. The system doesn't seem designed to handle the disturbing volume of homelessness that we face. Although another great outcome was that, which also required jumping over a bureaucratic block, came from my interaction with a 65-year-old woman who had been living in the underpass for a long time. She had a heartbreaking background. She had lived in Woodland Hills for years, but after a horrible car accident, which killed her husband, maimed her son, her life spiraled down and out of control. And she, at this point, she had these sores on her arms and she clearly needed medical attention. And she had been a nurse for more than 20 years at USC, and she knew the seriousness of her condition. And heartbreakingly, she told me, I asked her, why aren't you seeking attention? She said she didn't want to die in the underpass. But she hadn't been willing to seek medical attention because she feared losing her only friend, her dog, a dog that she said was like a child for her. Long story short, my team and I worked out a plan for her where Rock and Rescue agreed to hold her dog while she sought medical attention, and then she'd be checked into one of the very few, after she was patched up, she would be checked into one of the very few Project Room Key hotels that allows pets. Nothing is ever simple, and there were a few major hiccups, but the bottom line is the plan worked. I want to give props to Officer Dinsey, who agreed to transport her to the hospital in his squad car, and thanks to my staff and the LAHSA folks who pushed the bureaucracy to make it happen at that critical moment when she was ready. Now, when I go out to meet with local homeless people, I hear and have heard so many reasons why they become homeless. Domestic violence, drug addiction, loss of job, a healthcare crisis. But regardless of the reasons for any specific case, we need to find ways to bring down the price of permanent supportive housing units. Yeah, that's the ideal housing, but it's imperative that we pursue alternative shelter options like pallet shelters and shared housing models. This is an outcome I hope will be enabled from the federal case that's pending in Judge Carter's courtroom right now. Also, we need to work better with the federal, state, and county partners who provide the services, who need to help fill that gaping hole that leaves so many people on our streets each night? It's not humane for people to live on the streets, and it shouldn't be allowed. We should have better alternatives.